Hello, everyone. Thank you so much for helping in. If you're a returning subscriber, thank you so much for helping in. If you're new, you've met me for the first time. My name is Brian Taminyema. I'm a medical student studying radiography in school, and in my fourth year. And apart from my studies, I'm also a medical writer. And recently, I was awarded a badge on LinkedIn as one of the top writers, writing voice on LinkedIn. So it's an amazing honor. Thank you, LinkedIn, for that. Appreciation. It's amazing to see that my
Mm.
works are really, you know, seen to people. That it's really useful, and I'm really, really very happy for that. So I'm a medical writer. I do writings on medical articles, medical blog content, patient education materials, and social media content, continuing medical education materials as well. So if you need my services, you can reach out to me. So today I have an amazing guest speaker all the way from the UK. Hey, Alice, could you introduce yourself to the audience?
Thank you, Ransom. It's an absolute honour to be here today. So, thank you for your kind invitation. And hello to everybody who's watching at home. My name is Alice Benskin. I am a registered nutritionist here in the UK, and I've been involved in medical education for 2 years now. So I work with NutriTank, and we educate doctors, nurses, and healthcare workers about nutrition and lifestyle medicine. So exercise, sleep, stress management, etc. In terms of medical education in the UK, nutrition and lifestyle medicine doesn't get taught on the medical curriculum. So we really are working to change that and bring awareness to how, the foods we eat and a healthy lifestyle can really help to support our health and well-being.
Mm, mm. That was an amazing intro, Alice. Thank you so much for introducing yourself to the audience. So we have a couple of questions for you to answer. You ready?
Yeah, absolutely.
So if I'm looking down words, I'm reading the questions to Alice, because I wrote down the questions to read to her. So you've been wondering what am I looking downwards for? So the first question goes this way. Now I want to ask you a
Mm.
question before I move forward. What intrigued you to go ahead to study about things related to nutrition and diet in general? Tell us.
So I've been really passionate from a young age about nutrition and dietary changes, and that really came about from several people close to me living with chronic illness, and how nutrition can really be supportive in helping people with long-term conditions, both as a treatment but also from a preventative perspective. I was really blessed to be able to study with my undergraduate and postgraduate nutrition in greater depth, and to have the opportunity to work in a research and education capacity. My real passion for working particularly with complex trauma survivors led me to my current course of study, which is psychology. So integrating that with nutrition and finding ways to help individuals who are struggling with their mental health have a better quality of life through dietary and lifestyle medicine interventions.
Hmm. Hmm. That was amazing that your love for nutrition and diet started from childhood, right?
Mm. Yes, yeah, that's right.
Amazing, amazing, amazing. And that has made you to do an amazing job, to offer to the people about eating healthy, taking care of your mental. I think this month is a mental health awareness month. So,
Yeah.
you're really advocating about mental health and all such, too, because a lot of people are really facing incredible things you can't think of. So, thank you so much for sharing that with us.
Thank you.
Yeah, so
It's
that triggered
really,
me.
oh,
Okay,
sorry.
good.
Um, So I
That's
was just
good.
going to say, yes, it's Mental Health Awareness Week, and it's interesting how, we understand nutrition can help our heart health and, other things, but not always the connection is understood between nutrition and mental health. So it's really important, to have that awareness that what we eat really does affect our mental well-being.
Amazing, amazing. A lot of posts have been saying about mental health, people sharing their stories. That tells us that we need to talk about mental health
Mm,
more. It have to
yeah.
be a particular month, for creating awareness. It should be an everyday stuff because people are
Yes.
really facing a lot, even including me. So
Mm,
everybody has faced one or two things in some work. So that
yeah.
draws me to the first question. So how do nutrition and diet impact mental health and the management of complex trauma? Could you tell us?
Mm. That is a really great question. It's quite complex in that a lot of the research is still emerging. But we know from recent research, particularly from a team in Australia, from the Food and Mood Centre at Deakin University, that dietary patterns and mental health seem to be very strongly linked. So many modern diets contain a lot of the ultra processed foods. We've really moved away from eating whole foods in their natural state to heavy industrialization, commercialization of foods, and people having diets that are, very centered around fast foods, convenience. And these foods tend to be very low in nutrients, high in calories, and they often have high levels of sugars, salt, unhealthy fats, as well as added additives and preservatives, etc., which emerging research has indicated can really have a negative impact on our mental health. And this really is via a combination of different ways. Number one, they promote inflammation, and increased inflammation is a key mechanism that we'll see in most mental illnesses. Also, altering the composition of the gut microbiome, so the bacteria that inhabits our guts. These ultra processed foods encourage more pathogenic negative bacteria and mean that there is less of the good healthy bacteria that we need. And the other reason is because these foods are not nutrient dense, they're heavily processed, they don't have the levels of vitamins, minerals, and other nutrients that we need for health, including our brain health. So things like omega-3, things like the B vitamins, which are really essential for our mental health and well-being.
Hmm. Wow, that was an amazing narrative in that question, Alice. So before I go to the second question, there is something you talked about microbes.
Mm,
Talking about related to gut health, right? Said
yeah.
something about so in some foods we eat,
Mm,
there's some microorganisms that are in our food and also in our stomach, that breaks down the food. So I want to tell us something about something I have for you.
yes, yeah. So I think the first thing that comes to mind from what you've said is fermented foods. So many cultures will have um, fermented foods, for example, sauerkraut, kimchi. These are fermented cabbage foods that are enjoyed by Eastern European and Korean populations specifically. You also have things like kombucha, which is fermented green tea, um, natural yogurts, etc. And these foods, because they are fermented, they have what we would call a probiotic effect. So they encourage the growth of good bacteria in the gut. So it's really good if people can be including fermented foods in their diet on a daily basis. We also know that many vegetables they have what we call a prebiotic effect. So they help to create a really beneficial, positive environment for the good bacteria in our gut. So anything like onions, garlic, cruciferous vegetables, these particularly are fantastic in that respect for our gut and for promoting, good gut health. So really important to be consuming those foods as well as a wide array of vegetables, fruit, whole grains, nuts, seeds, having a higher fiber diet, because this really helps to create a really beneficial atmosphere in our gut microbiome and encourage the growth of good bacteria there.
Hmm. So what are you doing, based on people that are not aware of
Mm,
this terminologies you stated? Because there are people that not really updated about
mm.
things, nutrition and diet in general. So how are you and your teams working towards to make it more affordable and more reachable to everybody, including those that are not even aware of what is really happening in terms of nutrition and diet in general? So what are your teams doing about that?
That's a great question, Ransom. My colleagues and I, we are running a free webinar program. So this can be accessed by healthcare workers anywhere in the world. So we educate on a wide array of different topics pertaining to nutrition and lifestyle medicine. And then what happens is the doctors, nurses, and other healthcare professionals can then take those learnings and translate them into their clinical practice. So we really support them to do that through the creation of these free resources that we offer.
Mm, amazing. Kudos to you and your teams. So the second question goes this way.
Mm,
So what are some specific nutrients or dietaries, patterns that
mm.
have been shown to support mental well-being? So tell us.
So there's been a tremendous amount of research regarding the Mediterranean dietary pattern and how that can really support health generally, but particularly in recent years, mental health. So some of the research has shown a reduced prevalence in populations who are adhering closely to a Mediterranean type diet, and lower incidence of mental health conditions. It's really important, though, when saying this, to talk about the components of the Mediterranean diet. There are many different cultures in the world who all have different dietary patterns. One of the reasons that we have a lot of this data is because the Mediterranean diet has been quite heavily studied. So that doesn't necessarily mean other dietary patterns are bad. We need to look at the components of the Mediterranean diet and how we can translate that into our own cultural eating patterns. So the components are a high prevalence of vegetables, fruit, whole grains, healthy fats, so your oily fish, olive oil, and high levels of what we would call polyphenols. So these are the found in things like green tea, in colourful fruit and vegetables. Polyphenols give them their bright colours. All of these components have been associated with, better health outcomes overall, including mental health. And this is because of, this dietary patterns being anti-inflammatory and also nutrient dense, so low in ultra processed foods, low in salt and sugar, and higher in fiber as well.
Amazing, amazing, amazing. So you've already talked talked about gut health.
Mm.
You talked about mental health. So in a nutshell, can you explain the connection between gut health and mental health? Tell us.
So it's really important for us to have good gut health because there is a bi-directional communication between the gut and the brain. Some individuals may have encountered the term gut-brain axis. So this really refers to the bidirectional communication. So when individuals have, high levels of ultra-processed foods, this really causes negative alterations to the gut microbiome and increases levels of inflammation. And we see a correspondence in increased inflammation in the brain and poorer mental health outcomes as well.
Okay, so you know, I loved what you just said about the connection between, gut health and mental health. That was a perfect answer to that question, and I believe that the audience will greatly adore you for sharing narrative in that question. Thank you so much.
My
For
pleasure.
sharing. Yeah. So the fourth question goes this way: in your perspective, right? What role does nutrition play in the treatment and recovery process for individuals with complex trauma? So tell us.
Thank you. When individuals experience traumatic events, this is incredibly stressful for the body. So stress is in the body, it's a normal response, but it is hyperactivated during periods of traumatic events. And one of the things that happens in this case is that there is a cascade of biochemical events. And one of the things that happens is there is a depletion of nutrients. So some of the key nutrients that are depleted in stress are the B vitamins and vitamin C as well, and also magnesium. Now, all of these nutrients are really important for mental health and well-being. Many of the B vitamins are needed for the synthesis of neurotransmitters, for example, including serotonin. And also vitamin C is very important for synthesis of dopamine. And magnesium, when levels are lower, we know from the research that one of the things that can happen is there's an increased prevalence of anxiety. So one of the things that I've used in my approaches to supporting people with who've experienced complex trauma is really looking to improve dietary quality. So again, that's through increasing their consumption of fruits and vegetables and whole grains. Also quality sources of lean meat, so chicken, turkey, fish, particularly oily fish. And that's really, coming from that place of seeing that an individual who's presenting with complex trauma and related mental illness has really been through a lot and needs to be nourished and have the nutrients in their diet to be able to replete what they've experienced.
Mm, mm, mm. Wow, that was a great one. Thank you so much for sharing that with us, Alice. Thank you so much. So we have two more questions for you to go. Um, so wait, before I ask you the fifth question, how do you know someone has a complex trauma in your practice?
So this will come about from hearing from them in terms of what their experiences are. So to give an example, one of the cases I was speaking to a lady I was working with, and she had a lot of complex health conditions, including autoimmune disease, borderline personality disorder, obsessive compulsive disorder, depression, anxiety. And just through speaking to her, she had a really heartbreaking life experience. She'd been abandoned by her father, there'd been domestic violence in the home, and then she'd gone on later in life to experience domestic and sexual violence. So a lot of stress, a lot of trauma, and that had led her to alcohol and drug addiction to smoking and lots of unhealthy dietary habits. She developed obesity as well. So it's very interesting, when you've got a case before you, particularly a complex case, to really give space for the individual to talk about their experiences. Often there is a lot of complex trauma, and that can be a part of the picture in terms of how they have, come to where they are and become unwell because of the high levels of stress, of cortisol, inflammation, and then the effect that using addictive substances to cope, often with very traumatic experiences, can also elicit on health and well-being.
Mm. So, in a summarization of what you said, you talked about personal stories can help you and your teams to detect if someone is really faced with a complex traumatic situations, right?
Yes, yeah. Often it can just really help one to understand where they're coming from, but also to inform how you as a practitioner then support them. They will need trauma-informed support. They will need a lot more sensitivity, compassion, and multidisciplinary working as well. Probably it will be very effective for the doctor, for the nutritionist or dietitian to be working with a psychologist to make
Yeah,
sure that they're getting the full spectrum of support they need.
amazing. Thank you so much for sharing that with us, Alice.
Yeah.
So that drags us to the fifth question. All right. So, mm, are you sure you're ready for this fifth question?
I will give it the best I can. What's your question?
All right. So, how can someone use nutritional strategies, to manage stress and
Mm,
be more effectively?
it's a really great question. I think that because of what I've mentioned about stress depleting nutrients, it's really important that individuals have a really great diversity in terms of their diet, to having a really nutrient dense diet, just to support them to be getting all the nutrients they need, and also have resilience to stress as well. It's really important for individuals to be ensuring that they are getting a really varied, healthy diet, and trying to avoid and reduce as well things like the ultra processed foods and high sugar and salt and fat foods as well, energy drinks, caffeine. These are often things that we do reach for in times of stress, but they only really seek to exacerbate and make things worse.
Mm, 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 mm. So, does this strategies you offered now
Mm.
applicable to students globally?
Oh, sorry, what was the last bit? The med students?
Is it applicable for medical students as well globally?
Yes, yes. So medical school can often be a very high demand and very stressful. So definitely important to be ensuring that people are having a really healthy diet and lifestyle. But obviously there are challenges there in terms of being able to access healthy foods in your hospital or clinic settings. So one of the things that NutriTank are working to do is to support hospitals to have better food offerings for their medical staff, to make it easier for them to make those positive choices.
Amazing. That is amazing. That is really amazing. So we've come to the last question for you. Um, so it goes this way, right? So are there any particular foods or dietary habits that individuals should, avoid to maintain a better mental health? So tell us.
That's a really great question. And I think it goes back to some of what we've discussed already. So caffeine, there has been quite a lot of different research findings, and there's quite a bit of nuance with regards to caffeine. So some research has shown that, quality sources of caffeine, like filtered coffee, for instance, in moderate amounts, is actually beneficial for mental health, and was associated in a study I was reading the other day with reduced prevalence of depression. But then on the flip side, because of the nature of what caffeine is, for individuals who are living with anxiety, post-traumatic stress disorder, or panic disorders, they're already in a hypervigilant state. Having caffeine may exacerbate those already existing feelings of anxiety. So such individuals would potentially benefit from avoiding caffeine and having caffeine-free alternatives. Also, energy drinks are very, very popular, certainly in the UK, even amongst healthcare workers. Often these contain as much as 500 milligram of caffeine per can. And energy drinks, from the research we're seeing, are particularly detrimental to health generally, but mental health, associated with higher levels of suicidality, anxiety, depression, and worsened mental health symptoms in people who have already got diagnoses. So it's really important to be avoiding energy drinks.
Mm, mm, mm. Wow. So we've come to the end of the session. Alice, thank you so much. You've been an amazing guest speaker thus far, and I believe that the audience has really learned something from what you just said. And so before we wrap up the session, what are your last words for the audience?
Thank you so much, first of all, Ransom, for inviting me. For everybody who has listened, I'd just like to encourage, as a final note to everybody listening, just to be aware mindfully of how your diet may be impacting on your mental health, to really be looking to reduce ultra-processed foods, alcohol, caffeine, and really be consuming more of a whole food diet, looking to have as much diversity in terms of fruit and vegetables as is possible. And I really encourage you as well to sign up for free at www.nutritank.com for any of our free resources on nutrition, so you can learn. Thank you.
Yeah. So if you love this content, do well to subscribe, like, and share to your network. Hopefully, someone in your network will really adore this video. Thank you so much, Alice. Thank you, everyone.
Thank you. Absolute pleasure. Bless you.